program to Cottage Grove.
So I haven't read the newspaper this morning.
Okay.
So what was released today?
Well, it mentioned, it was in that side section. It wasn't in one of the main parts. You know, there was a little additional thing in there. And it says in there, Eugene YMCA receives quite a bit of money to expand the programs for the childcare programs, various things in Cottage Grove.
In South Lane. Yeah, and I don't really touch on that very much in my slides, but there are definitely some donors who do want to support what's happening in Cottage Grove. And I know that when we started in Cottage Grove a year ago, September was when we first went down there to start operating at Harrison Elementary School. In the blue chip. Okay. We were welcomed with open arms. Like, it was one of the most amazing feelings to go into a small community, and they wanted us to be there providing childcare for all of their families down there. And so right now we're operating at Latham Elementary School. I don't know if anyone's familiar with Latham, but it was built in, I think, the late 1800s or mid 1800s. It is a beautiful old school. And our youth development team here at the Y, we have we really just want to go down there and turn it into a Y. The school it's just gorgeous. Has a nice little corner of land right by the freeway, it's beautiful. So yeah, so we are offering 100% scholarships to families in Cottage Grove.
That's great. So, well, just to go ahead with your program now, Holly.
Okay, let me share my screen. Oh, here we go. Okay. Okay, so I put this together with a lot of pictures. So this is my family. You asked about them. So JJ's at the bottom. He's a freshman. So he got to graduate in the middle of a pandemic, and they actually did pull off a graduation at Marist. So it was in July, but he did get to go, throw his hat, walk across, get his diploma. They were all spaced. We watched it at home. It was streamed for us in our living room, but it was amazing. And so Marist did a really good job with their kiddos through graduation. Purple shirt is my 7th grader. He's currently here with me. He's at somebody else's desk doing his homework. Then me, this is my sophomore Jackson. And then there's Corey with his COVID Santa beard, which he started growing on March 12th. So yes, that's my family right there. So who we listen to, we always try to explain to families or anyone who we get our guidance from. So these are the big 4, the quadfecta, the Early Learning Division, the state of Oregon. We try to pay attention a lot to what Kate says, just so we can get a little insight as to what direction we might be headed. Last Friday is going to throw us for a loop as to whether or not school does go back into session in January, because we'll then be what we're going to call our 4th inning of entertainment fund for guidance switches, Oregon Health Authority, and then the CDC. So these are the 4 that we try to listen to and follow. The Early Learning Division, though, is the big one. What they say we have to follow, but we can be stricter if we so choose. So I kind of liked when those numbers, so I went a little deeper into those numbers. So on March 11th, 2020, this is what we had. In Y Youth Development World, March 12th is when the world stopped. It was a Thursday. That's when the world shut down, according to us. So we had this many programs. These are all of our school age programs based on which elementary schools. And then we had our 3 early learning programs. And so we had about 795 youth enrolled at that time. So March 12th, last day of school. March 13th would have been a no school day. And then school was put on a pause for a couple weeks, and then ultimately was shut down. So pre-COVID, and this is one of my boys' favorite books, so I was really excited that I was able to find it. But pre-COVID, the biggest change that we've found right now is that we were able to have that physical interaction with each other. We were able to see people face to face. We were able to have people come in. We could help them register. We just were able to be all together in one space, see our staff face to face, have team meetings in a group and exchange. Like we could essentially, we could give a hug. If you were having a rough day, we could give you a hug. Oh, hi, Coop. This is Cooper. In March and April, typically we would have started signing up for the following summer and then the following school year. And so when the pandemic hit, what we did was we signed people up for the fall because we thought that in September, life was going to return to normal. So we had wait lists for all 17 of our programs. We just kept telling people, nope, as soon as we know what's going to happen, we'll get you into those programs. And then we all know what happened after that. We were running ratios 1 to 10 in preschool rooms and then a 1 to 15. Some of our programs had as much as 65 kids that were enrolled in them. And some of them maybe had 32. So those were the numbers of a lot of our programs. So March hit, and once we got our programs enrolled or started going from March through mid-June, it was 112 kids total. The Y was running programs at Holt and Meadowview in South Eugene for school age. And then our early learning programs were based out of this facility here. We did started with the partnership, which is how the emergency childcare all kind of got going at the emergency operation command control that was happening down at the county. So between the city and the county and Bethel and the Y and the school district, we just like the right people were sitting at the table, and there was a need. And at that time, the superintendent said that there would be no fee for childcare and that these families needed to be served. And so we started with essential workers, which also was a mandate of the governor and the early learning division, is that the families that we served needed to be essential workers. And at that time, the essential workers were just the medical professionals, emergency responders. I think those might have been the two at first. So that's who we started with. So it was 112. Our ratios were a 1 to 10 and they had to be very spread out. 6 feet. It was free. There was no cost to the childcare. So the Y, we're operating childcare with, the lack of a better word, we weren't getting paid. We were doing it out of the goodness of our heart, and because it's the right thing to do. The Y has always stood up for what is right and to help and serve our community. We had to agree to understand that we were working with families who were coming in contact with youth who had COVID, or families who were working with other people who did have the coronavirus. And so that was something we took very seriously. And it didn't take us long to make our decision that, yes, we are going to offer childcare, but we did have to acknowledge that we recognized we were putting ourselves essentially on the front line serving these families. So governor puts out her executive order, schools closed down, we're free. We listened to the Oregon Department of Education and the Early Learning Division, and then we served our essential workers. I was trying to be clever with my slides. So this is what a classroom looked like in the spring. We started out using a lot of pool noodles and painter's tape, here. So painter's tape, pool noodles, Clorox, and gloves. These are a staple of just about any Y emergency childcare program right now. Pool noodles are used for physical distancing. Painter's tape is what we use to separate them all over. And then our staff are cleaning and sanitizing multiple times a day. So this is what a program looked like. We had to keep them on separate rugs. They each had their own individual supplies at each table. They weren't allowed to share with each other. And every day at the end of program, we would be cleaning and we would be sanitizing everything. We adjusted our staffing hours. What used to be a 7 to 6 program, we adjusted to a 7:30 to 5:30 program because of the amount of cleaning and sanitizing that was taking place. We estimate, and I know that the environmental gurus are going to come after us, but we estimate we've probably used 30,000 rubber gloves. The beginning of summer, we had 18,000 in our office just because of the amount of glove wearing and protection that we are doing for our staff. And we try to switch to cloth masks so that we weren't using as many paper masks. So we were trying to justify it in our heads what we were going to fill the landfill with. But we just wanted to keep kids safe. So this is Cassie. She's sanitizing one of our physically distancing poles that we use in our programs. We also stopped using the word social distancing in the very, very beginning. It didn't come out of our mouths very often, simply because we wanted staff and youth to feel like you can be social. You just have to be physically distanced from your friend by 6 feet. And so to us, it's always been physically distancing and not social distancing. But we clean dirty tables. So then we hit summer, and summer, the guidance changed again. So the guidance to us changed in the first 6 months. It probably changed every 3 weeks. We would have a new rule, a new guidance. We were on weekly Zoom calls with the early learning division, trying to figure out how certain things were running. If you didn't agree to be an emergency childcare program, you had to shut down. So a lot of programs, specifically a lot of the in-homes, did end up shutting down because a lot of businesses were shutting down as well. So when summer hit, this would be one of those funny little quirks. We were able to take our programs, and 2 of them ran as, well, let's see. 2 of them ran as what they called summer care programs. One of them ran as a child care program. So both underneath the Y. One of those groups got to go swimming. The other groups were not allowed to go swimming. So that's just a little bit of policy funniness that we got to deal with. But this is what we did for summer. Stable groups. You have to keep in stable groups. So you have 10 kids in a group. They had to stay 10 kids in that group. We weren't allowed to flip-flop them. Staff needed to stay the same. But we had 167 youth enrolled for the summer program over those 10 weeks throughout all of these programs. This would have been one of our first partnerships with the church. Typically our summer programs, we hop onto a school bus, we go camping. We usually have about 250, 260 kids during the summer for a consistent 10 to 12 week summer. This summer we only had 167 individual kids. But this year our summers were in classrooms, or they were in a gym or a cafeteria at Roosevelt or at Meadowview, in the gyms and the classrooms, and they were focused slowly on those spaces. No field trips. We could go on walking field trips. We're not allowed to have like a visitor come in and do a presentation. Everything has to be on Zoom, all for the safety of the kids and ensuring that the people that come in contact with them are safe. There's our big 4. We stopped using the term pivot, and we use plot twist now. It just helps us feel a little bit happier, because we were pivot and bandwidth. Those are 2 words that we don't like anymore. So plot twist. This is the Roosevelt gym. So this is before elementary school kids had to wear face coverings and masks, but this is the group. This was their tie-dye day. We had 2 groups in the cafeteria at Roosevelt, and we had to have a barrier in between them so they wouldn't go talk to the other group. So this was our makeshift pipe barrier. Let's see. This is our group at First Congregational Church, nicely spaced out, having signs to show the drivers as they're going by. Then we hit September, or actually August 14th. August 14th, new guidance came out for the summer. So we're pretty excited. It hasn't changed in almost 3 months. So it's kind of exciting when things stay the same for that long. So now we're up to about 165 kids, and our programs are separated by grades to help with the comprehensive distance learning, which is not easy. It's not easy for those teachers who are on one side of the screen, or for our youth who are on this side of the screen, or for their families when they pick them up. But right now we have 6 school age programs, and then we have three early learning programs. Each kid in our early learning or in our preschool room, they each have a rug. So, and that's when they walk in the morning, they're handed specific toys that they get to play with. And so this is Bowden, and he's on his rug with his toys, and the staff will sanitize and disinfect the toys so that then another kiddo will be able to play with them later. But he's only allowed to play with those toys on his mat when they come in the morning. So now we've got face masks. This is Baby Yoda. He makes quite a few visits with the specific staff. We celebrated the first day of school Y style. So this is Quinn. He's one of our staff. Here's three kiddos that are at the Grace Fellowship program. And then we have our CDL, our comprehensive distance learning. So each kiddo has a laptop or an iPad and headphones that they have been given from their school. And what we've done is in each of our spaces, we've separated the tables out by painter's tape. And we then, so this is the crazy schedule. And if anyone can understand how it works at first sight, I applaud you. And next time I get a schedule like this, I will be calling you first. But this is the schedule that the school district follows. And what it is there's every elementary school has had a choice between 3 different schedules. So they had the AB schedule, they had the CD schedule, or they had the EF schedule. So 3 different schedules. If it's in blue, that means that it's live. So anything that they're doing online is live learning. The teacher's right there. Kids need to be present. Anything that is green would be what is not live, but there would be homework and classwork for them to participate outside. So what the schools did was each grade then chose which schedule they wanted to follow. So we've got Adams. Well, kindergarten and first is following the A schedule. Second and third is following the C schedule. And then fourth and fifth is following the E schedule. Now, when we registered kids for the program, you couldn't really take that into account. So we, at our programs, have kindergarten and first graders who are on 3 different schedules. And we are running with 2 to 3 staff. So 2 to 3 staff with 20 youth, helping them to get on their Zoom classes, helping them to figure out how to navigate their clever codes and their Google Classrooms for kindergartners, some who have never even been in a preschool or a pre-K program. So to say that it's been hard is an understatement, but helping these kids figure out their CDL life has been a really, really big struggle. Struggle for this crew right here. So these are our staff. These are a couple of our physically distancing gatherings we had. The top one is the end of summer. And then the bottom one was, I think this was in summer also. But these were the 2 times that we were able to get together and staff felt safe doing that. So I guess the people, well, let me go back to staff. Our staff are tired. And it's hard for us to support them without being able to see them. And communication with families. Families aren't allowed to come into our spaces. They have to stay at the doors per the early learning guidance. And we have what we call a door greeter. They're the ones that are doing the health screens with the kids when they come to the door, taking the temp, asking the questions, doing the hand sanitizer, sending them to their spaces. It's hard. And right now we're just trying to figure out how we can support and help our staff. We've done a self-care workshop with Ophelia's Place. We've got a YD discussion group that happens a couple times a month that staff can have those conversations about what's happening in the world. But it's hard. We were doing one thing 8 months ago, and all of a sudden now we're doing a lot of cleaning and sanitizing and helping to support kids with apps and dashboards that a lot of us have no clue what they are. I just had a couple questions just to answer. A lot of the realities and challenges that families are facing is the cost. So what they used to have, what they used to pay would be like $300 a month. Now programs are asking, we ask $725. Some programs are asking over $1,000. We've been very fortunate to receive donations from different organizations so that we are able to offer some good financial assistance. We are in good communication with the McKinney-Vento program, so those unhoused youth through the school districts. And so those youth are able to come into our programs 100%. So they don't have to pay. The school district helps sometimes to get them to the programs that we're having right now because transportation is often a barrier. But cost is the big one. And we are able to help a lot of that at any of our programs. We used to have a piece of paper that families would fill out. Now we just say, what works with your budget? You know, look at what your income and expenses are and how can we help you to make sure that happens. And then some of the complications that we experience is relationship building. We pride ourselves on building those relationships with our families, and it's hard when we're not able to see them. When we communicate via email or Zoom or on a phone call, text messaging. So, you know, trying to figure out how to do that it's hard. And losing that physical contact when you could do a high five or a hug or anything, it's not easy. Who we're grateful for those community partners, anybody who has stepped up to help the Y. Very appreciative of any donations that come in, whether they're supplies. We've had families drop off food for us. Like the staff are always so excited for something when that shows up. We're very grateful for the families who understand and follow the rules and guidance that the Early Learning Division has put forth, and who are following what our government our governor is trying to do to ensure that we can stop the spread, and so that we can go back to school safely, and that are wearing their face coverings and their masks, and they're avoiding the large group functions. Very grateful for the staff. Without them, we wouldn't be able to be doing this. Like, there's no way. If they wouldn't have said yes, then we wouldn't have been able to provide what we're providing. And then I've got a pretty good team. There's 5 of us. 2 of us work in the office. 3 of them are working from their homes. But we've definitely learned a new way of doing things and trying to communicate and keep everything. I didn't have a closing screen. I forgot that part. There you go. There's my presentation. Thank you.
Thank you, Holly.
I'm ready for questions.
How do we want to do questions?
Charlie, you're Charles. Charles,
I'd suggest raise your hand if you want to ask a question. And since I did that right away, I'm first. It isn't so much a question as it's appreciation for the YMCA preschool. During the 70s and 80s, I sent 3 kids to the YMCA preschool, mostly because they were the gold standard then for childcare. And if they are successful in life, and they are, I have to credit YMCA as well as excellent parentage. The other part is I'm so glad to see YMCA reaching out to the rural areas, My daughter lives outside of a city that has less than 3,000 people in it. Daycare of inequality anyway is just not there. So I'm really glad to see you reaching out to Cottage Grove. And I understand that those numbers are more problematic because they're smaller, but it's an important way to get more childcare in the communities. Thank you very much.
Thank you.
Janet,
I just mentioned that I did find that little article since she mentioned Cottage Grove, and the money came from the Ford Family Foundation and Pacific Power Foundation.
Janet had a question.
What, are you aware of how children that are toddlers, infants are being cared for? Are there any programs for these parents?
There are.
Guys?
Yeah, there's the majority of them are going to probably be the in-home providers. Are we talking specifically right now during this lovely pandemic?
No.
Yeah, one of the guidelines that came out when the Early Learning Division released it on August 14th is that when they're in their stable groups, so when our staff are like our youngest are 2.5 to 4-year-olds, and they can hug. Those preschoolers can sit beside them. Like we do not have to follow physical distancing as of September. We do not have to follow it in our programs. So that would go the same thing for any infant program. And they are running. I mean, there's this group resource, it's 211. I'm personally not a fan of 211 because it takes forever for you to figure out where you want to go on it, whether online or the phone number, but it's supposed to help families find childcare. But yeah, 211, and then I always send people to the Quality Care Connections up at LCC. And somebody spoke about Catherine in one of the emails, but she's at LCC, but Quality Care Connections can help with infant care too. There's not a lot of people though that want to put their babies in care right now. Yeah.
Yeah, with that, the touch thing is so important at that age.
Yeah, which is why staff were worried, like after going 5 months of notching, like having to keep that 6 foot physical distance. And then when the guidance changed, I don't want to say we had backpedaling, but we had staff who were really concerned. They're like, we've been preached at for this long about stay safe, your face mask, you have to do gloves. It was hard.
Yeah.
It was hard for them to.
If they'd had adequate testing, it probably wouldn't have been an issue. But if everybody's tested at the beginning, that's not you're not transmitting the COVID germs, but it's the
knowledge of the disease has changed, and that
it has.
So that's a big part of it. I think that children aren't the spreaders that we feared they were.
We'll say though that we have a sibling program right now whose younger sibling has it, and the one in our 3. So the younger sibling does have it, and so we are waiting to hear what their test is, so then we know what our next step would be. But you have to be tested every day.
Yeah.
Like we really would be. I've been tested twice, and it's not a fun experience.
Well, they're trying to develop saliva tests, so
They are.
University of Washington's working on it. So, hey, Linda.
Holly, were you able to qualify for the PPP funds?
We did. The Y did as a whole. Yeah. And so in the spring, we were able to use that, and so we were able to pay our staff who were working during that time, and then we were able, because the Y shut down for several months, and so youth development had staff working, and then the rest of the Y either were working from home or were not able to work, but we did have the funding to pay them. We've also, the Early Learning Division has had several grants. It's the easiest application I've ever filled out, and so we've received, I think, three different buckets of money from the Early Learning Division. And then United Way is working with us right now to help we're having extra staff in our programs for that comprehensive distance learning bit, because it's hard. 2 staff and 20 kids, it's not easy. And so we've had people who've stepped up and helped us with that.
Very good.
So other than you, there are several other daycare centers in the area. I saw where there's at least 3 have been placed on the COVID list because they had COVID outbreaks. Adventure Fair.
Yeah, New Dream.
Yeah. So I've been keeping track of that. So
it's hard. Like, we have to ask questions when families come every day. So, have you been in contact with anybody? Does anybody in your family have a new or worsening cough? And this, I don't know, it's probably, seriously, we've lost complete, I don't even know what time it is, what day it is, but it was a while ago. We had a kiddo who they just weren't feeling well. And we had a conversation with the family, and the family's like, yeah, well, mom's had a cough. And I'm like, really? Mom's had a new or worsening cough? Oh yeah, she's still going to work. And I'm like, really? She's still going to work with a new or worsening cough? And he's like, well, yeah, well, can my daughter come back? And I'm like, no, you lied when you dropped your kid off. Like, you can't come. So it's getting those families, and it's getting those families to answer the questions truthfully. Like, that's the hardest part is if you have a cough, just go get the test. Just go get it.
And that's all you need to tell them to get the test. I have a cough.
Yes. And there, like, early learning division, we have a list of, like, if you have one of the COVID symptoms, then you have to quarantine for 14 days, no matter what. If you've come in contact with somebody who is positive or presumptive, you have to get the test, and you have to stay out for 14 days. Me, I had a cough. There's not a lot of people I see. I hadn't come into any contact. I had to just get the test. It was either a test or get a note from my doctor that said she just has a little cough. It was easier for me to get the COVID test than to make an appointment with my doctor.
Gosh.
Yeah.
It's somewhat- If it means you have to be isolated for 14 days, you can see why people lie. I mean,
100%. Yes. Yeah. And that's
if they don't work, they don't have money and they can't pay for childcare.
totally no. And we see it, and we've had to have conversations with our staff about their social circles. So if this is who your bubble is, like my bubble is my family, well, then Cooper's got his own bubble. Jackson's got his own bubble. Corey has his bubble. Maritza and I have been, linking elbows since March. Like, she and I have been working together. So we're in our own bubble. Well, if Maritza gets it, I have to quarantine for 14 days. Like, we try to tell staff, if you walk into multiple spaces and if you're in there for 15 minutes or whatnot, and you're not wearing whatever, you too will have to quarantine. So we're just trying to help people understand this is what the guidance says today. It might change tomorrow. It probably will change tomorrow. But as of right now, just follow what the guidance says, because we're trying to do our best.
Hey, Linda.
Holly, are you mostly servicing essential workers, children still?
We have some students. So no, I think it's a little bit of both now. A lot of people have gone back to work. There's a fear there. Well, this would be we're trying to do it the right way, but people aren't doing it the right way. Those neighborhood pods that have started, those aren't supposed to happen in childcare world. And so I think a lot of people think that they're safer, and they very well could be. But as far as childcare guidances, they shouldn't be happening, because 4 kids over, not from your family, that's considered an illegal childcare program. So I think a lot of people are going that route, but we've kept a lot of families from March until now, but it's probably all over the place.
So
Yeah.
for many of us who don't have young children around, explain to me what the neighborhood pods are.
So if, well, Cooper was invited to one, but his mean mom said no, neighborhood pod. So
It's just-
So a neighborhood pod would be a parent or maybe a college kid who is going to stay home with those 5 kids and help them to do their distance learning from home for the day. So they consider themselves a neighborhood pod. And so there's a lot of families who have chosen that route, or there was already a parent who wasn't working. And so it's easy. It's not expensive, because it's hard. It's not cheap to run all day childcare.
Oh, yeah. Yeah.
So from staffing and rental
Yeah.
fees and Freddie?
Question.
Well, how are
Um,
you involved at home,
first of
Holly, with the distance learning for your kids?
Well, it's hard. It's very hard. My middle son is struggling a lot, and he doesn't want to get out of bed. I get a phone call from the school that says he hasn't attended class. And so that's hard. My family also experienced 4 different deaths in the very beginning of COVID. And so we had a close family friend pass away of breast cancer. Our neighbor died of a heart attack. A friend up the street committed suicide, and then my father-in-law died. So in a matter of 4 months, we had a lot. And then on top of that, I had a freshman the oldest went off to college. So it's been hard. Cooper has, he's the baby. It's not easy. It's not easy at all. Like I feel like I'm failing a lot of the time. Because it's hard. I want to support my team here at the Y so that they can keep these kids safe and help them. And then I get home and it's hard. It's hard. But I'm not the only one. I know that. I'm not the only one who's going through this.
That's the reason I asked that question, because I think it's typical of parents dealing, and to hear from a parent going through all that, it gives you a feel for what all parents are going through.
Yeah, and we are not able to have somebody work from home or stay home. Like Corey had to work from home in the spring. Cooper and I love him very much, but he really didn't help with homework in the spring. So your dad. We essentially had to tell him to be quiet because he talked too loud. But we love him. But it's not easy at all. It's hard. Freddie, you had a question?
Yes. Well, first of all, I want to thank you for providing some pictures of the classrooms, because I was trying to imagine what it would be like for the kids, in that space, and how you separate and what, it's very binding. It's amazing. And since the Y has moved into some 4J buildings, is the school district providing that at no cost to the Y? Or are you leasing that space from a couple of schools like Roosevelt from 4J?
So we're renting at a very, very, very reasonable price.
I would assume that.
Yeah, it is. The churches, they're a little higher, just a tad higher.
Yeah.
But yeah, no, we are paying. And one of the things that the United Way dollars that they've granted us, like I've got a list, like that money's going to pay for rental space. It's going to pay for McKinney-Vento youth. It's going to pay for those extra staff. So yeah, so we still don't like to pay the money, but it's the cost of doing business.
Mm-hmm.
Yeah.
Can I ask one more question? It seems like if we get a new administration, there might be some changes regarding the salaries that childcare providers receive, in terms of better benefits, hazard pay. How do you feel, or how do you think your staff feels about unionizing childcare providers?
Product of a union?
In California,
I'm the product of a union. My father was a mill worker, a paper mill. And
Mhm.
I don't know. I don't know what my staff would think about it. We don't have benefits at the Y. So we have sick, and full-time employees have sick and vacation. Part-time employees
okay.
only have sick.
Yeah.
Sorry, sick pay. We have no medical
Mhm.
insurance, no dental insurance, no nothing.
Mhm.
I
Right.
I don't know. I know that I don't know what they would think. I don't. I know that we are on the very low end of wages for what we pay.
Yes. Yeah.
We are, like, our site directors get paid 15 an hour. Our assistants get paid minimum. And I've had staff who've been with us for years, and they could go to another program and get paid more, but yet they stay with us. And I would like to think that was, we're a goofy, tight knit, dysfunctional family, and we were before COVID, but we have a good time. So I don't know. We'd have to raise our prices, and I think that's the hardest part. Is you'd have to raise our prices, and then we would really be serving the families. We'd be offering more financial assistance. So then, yeah, I mean, I would love to pay my staff more. I would love to pay them more.
Mhm.
Yeah.
And you're a family care provider, so a family care center. And so the home care providers are apparently getting like $10 an hour or less. And some of them were not even taking a salary if they were providing childcare. In the beginning, it
Mhm.
was rough, apparently.
Yeah.
So some of them
Yeah.
just closed down.
Well, and
Yeah.
the rules were very, very tight when we first signed. I
Right.
mean, we could follow them because, I mean, we had a team, like Maritza and I would go to the sites, we'd set them up. We read that silly rule book over and over and over again, but it's hard if you don't have the numbers to have the tuition. I don't know how people would do it. And it's a lot of cleaning, a lot of sanitizing.
Amazing. I know.
Hmm.
Thank you.
Thank you.
Thank you. Thank you, Holly. That was
Yeah.
quite enlightening.
I try.